What if New York Governor Andrew Cuomo is right that we got it all wrong? Cuomo did something that politicians rarely do. He admitted that he and others handled the pandemic all wrong.
We all failed at that business, right? All the early national experts, here's my projection model, here's my projection model. They were all wrong. They were all wrong.
It is refreshing to hear a politician admit to a mistake, especially in the age of Trump when everything is the greatest. More importantly, we need to know what went wrong and what went right. We need an honest assessment, the costs and the benefits of shutting down America. What we don't need are scientists and politicians who duck and cover from the truth. And scientists did get it wrong, way wrong.
They were all wrong. They were all wrong.
The mantra through the pandemic was and still is, listen to the scientists. But scientists will always err on the side of caution. Their research and guidance is judged by two factors: spread of disease and mortality rate. The infectious disease researchers don't have to concern themselves with the effects on the economy or the effects on mental health. It behooves them to lean towards a worst case scenario, because if it doesn't happen, nobody can prove they were wrong. They can always claim it would have been much worse if we didn't take drastic measures. But now, Governor Cuomo has had enough. The governor did everything the scientists told him to do, and still New York had the worst fatality rate in the country, 150 out of every 100,000. Close behind them was New Jersey, 125 out of 100,000. Two states that were quick to close down and slow to reopen. Defenders of Governor Cuomo and New Jersey Governor Phil Murphy will point out that their states were hit hard and early by the virus. But Washington State was hit the earliest, and its fatality rate is just 14 in 100,000. Now, density of population had something to do with the high fatality rates in New Jersey and New York, but not all. Governor Cuomo and Governor Murphy's decision to force nursing homes to accept COVID-19 patients had a lot more to do with it. Murphy, Cuomo, and other governors made that decision based on scientific projections that if they didn't, hospitals would be overwhelmed with patients, except for the fact that in rare cases, that never happened. Now, none of this is to criticize, but to learn from mistakes. It is why the admission by Governor Cuomo is so important. The first step towards recovery is admitting you have a problem. Part of the problem was following scientific theory in a vacuum. Elected officials in the future need to make decisions not just by following the scientists, but following economists, following mental health professionals, following small business owners and other stakeholders. In a country bitterly divided by political tribalism, it is difficult for many not to take political advantage by mistakes made on both sides. But how can you criticize steps taken for a problem that we've never encountered before in modern society? We were building a parachute on the way down. The good news is we haven't hit bottom yet. There is expected to be a second wave this fall or winter, and our elected officials need to make decisions without being too complacent after what's expected to be a mild summer of 2020 and still not overreact like we did in the spring of 2020. And that balancing act needs to be done, unfortunately, in the circus tent of a 2020 election. I guess it's too much to expect that those decisions can be made without the hecklers of the media and other political partisans in the peanut gallery. Just know when you hear it that it's cheap, it's easy, and it's not helpful at all. I'm Larry Mendte. We'll talk again soon.